I know that so many of the women here are already donors to organizations or involved in this kind of work in some way. And I'm just wondering, if you could give someone advice on how to make decisions about how they invest or how they get involved, what would your advice to them be?
One thing you need to look at if you're looking at any organization that you want to support is how they spend the money that they receive. What happens in terms of the overhead versus the actual end product reaching the recipient. I think that's very important. Also, there is a big trend, as he's pointed out, with regard to donors now being much more involved in what is actually going on when an organization says that it does this or that. So if you're giving, if you have an opportunity, do a field trip and go, even if it's overseas. We just took some of our donors to Ghana, where we've shipped about 19 40-foot containers for them to look at recipient hospitals and see if those biomedical equipment pieces and the supplies are used in a meaningful way. So I think actually getting evidence of what your money or your donation has provided, whether it's in kind or actually funds.
One of the pieces is the organization really looking at their work and lifting up the hood and trying to innovate and trying to try new things and not just doing it the same old way? And I think that's really important because, these challenges, and we were having a little conversation at lunch about this as well. We have enough food in the world to feed everybody, and yet we're not doing it. And so when you think about these things and you think about how we're going to work to break down those barriers and work at those causes as to why it isn't happening, you can't do it the same old way. And so I think innovation is tremendously important, as well as having a dialogue about what you're learning. And to acknowledge that sometimes what a group is going to learn is that something didn't work. And you want them to be able to tell you that. And so at CARE, we have a lot of dialogue about this. And I sometimes, as somebody who talks more about some of our successes, I also really value those moments where we have to go to somebody and say, we tried 2 things and only one of them worked, but we maybe learned more from the one that didn't, and having that conversation.
A couple of quick ones. I guess no matter what it is, pick something, do something, and pick your passion. I get in this conversation with my daughter. She's a senior at Penn State, and she says, it's an overwhelming array of choices. And I said, and so she's hesitant to go down any one path. I said, just choose something then follow your heart. Because there aren't a lot of wrong choices out there, so I guess that's what I would encourage. And the second piece is those that work for NGOs, we have to figure a way to bring some of the activities together. There's over 25,000 NGOs in the water space, and so a person like me, we're trying to choose who do we partner with, folks like CARE and others. There's some with great scale, but others that are 2 people in a rented back office, and we have to figure out how do we bring those together? Those that are trying to get to the same endpoint, how do we work across these silos that we've set up and get some scale, get some power behind it rather than trying to do everything individually?
I would look for an entity which is thoughtful in their risk. I mean, a risk-averse entity is not an entity that's going to make a big difference in changing the status quo. So it's not about running off of cliffs, but if an entity isn't prepared to take a little risk with what they're doing, you may want to think about putting your money elsewhere. The second is, to what extent it's that sustainability is not just a throw word, but it's actually a conceptual part of what they're doing. If they're actually looking at the broader aspects of sustainability, and not just by how do we keep taking your money, sustaining the financial elements, but how do they sustain the managerial, the technical, the political forces that are required to keep moving the area. And I think third, and it relates to that and builds from that, is to what extent they're actually contributing to the creation of leadership. At the end of the day, I can't think of anything which on the one hand is more abstract but more concrete in its absence than leadership in development areas. I mean, we all may have difficulty describing it, but we all know when it's not there. We've all been in situations at different times where all of the pieces were there and just what was missing was some leadership. And I think that really characterizes much of the challenges we have in development, and especially around women's issues. Because it's not like the raw materials aren't there. It's not like the opportunity isn't there. It's not like the drive isn't there. One does need to support leadership in the area. And maybe just a caveat to that is that looking at entities, and one part of my career I was chief of health at UNICEF, and as you know, it famously advocates for a few pennies a day, what it can, you know, what would an immunization cost, or a few pennies a day, saving lives, et cetera. And one has to make the distinction between advocating for your program, which is what that is, and appropriately kind of put it in simple terms for people to understand, and programming your advocacy, which is actually simplistic. Simple is very good, simplistic is very dangerous. So it isn't about just showing up with a few pennies a day, or with just the commodities, it's the systems, it's the human capacity. Development is complicated. It's challenging. We need to make it clear in terms of where the levers are and what can be pushed. But institutions and entities have to approach it with the breadth and respect for the complexities that are involved in that process. I think there's a certain humility that we need to take to it. Many of the achievements that have been made, in particular in the health sector, were in spite of the health and medical communities. They were driven by other parameters, by social empowerment, by economic empowerment, by communications, by education, all of those other determinants that drove the progress. And it wasn't just us showing up with our vaccines, although that's an extremely important piece.
I'm really struck by this generation now that I'm teaching. You know, I've been around a few years, like I know we all have, and we remembered what it was when we went to school. And maybe it's just the students that end up in my classes, but they just tend to be a pretty conscious group about exactly that question, and it's a good thing. And I have been lectured, again, this is a learning experience for me as well. I've been lectured by my business students oftentimes, who will remind me that our generation now, when we go to, you know, the internet and we're buying something, you know, we look at that company and who are they? And one company that often gets mentioned is Patagonia, which I didn't know, but evidently they produce outdoor equipment or something. And they're known to have a very progressive attitude about development and that in the third world. And so students will tell me that we will be willing to pay more. Well, back when I was growing up, we were not. We didn't even make that connection. We would get the cheapest thing and all that. And they remind me, well, no, we do want to know what you're doing with the money and what you stand for. And many of them who are, again, in business are going to, you know, hopefully work in that field. And they'll come back to me and say, you know, it's not just about CSR, right, corporate social responsibility. It's about what that company is actually doing. It's one thing to put out the report, but what are they doing out there to help? And I know often then I try to channel this discussion that we have to humanitarian versus development. Because one of our curses, I find, is that we have the problem of the CNN effect or the BBC effect of, oh my God, there's a starving child, help now. And of course, it is amazing the number of people in many countries, including this one, who simply contribute, and that's great. But see, the way I look at it is, okay, once you've made that decision to put some money down, doesn't matter how much, take an interest then in who's going to do what, but to not just save the child or save the person now, and we make no apology for that. We must save lives. But folks, we're dealing with the most vulnerable in all of these communities where we work, and there's always a next time. And there's a lot of agencies like us, we work together a lot with CARE, for example, as partners, where we're trying to deal with the underlying causes. And see, already that's taken a minute to mention, and some of you are thinking, oh God, here we go. And this is our problem, is that it works the same with many governments and many of those who contribute to us, is it gets a little old at times, and they don't really have the time for, what is the solution? And I'm afraid that we are doomed otherwise to just focus so much on the immediate response, although we need that. My agency's budget last year was $6 billion with the B. That is not, for the world, something to be proud of, we do what we have to do, but the vast majority of that was for emergency relief. When I joined in 1985, as a typical country director, 80% of the resources that I would have would be for the development side, the school feeding programs, the maternal child health programs, and then I'd have 15%, 20% on the side if an emergency happened. Today, it's exactly the opposite. So that's where the $6 billion increase comes from, is that I've got 20%, 15% to work with for the solution. So we're well funded oftentimes, not always, but on the emergency side, but we're not paying attention longer term. And so that's a long way of saying that this is a way of, when you get people asking you the questions, then where's the hook, where's the interest there? Who's doing what to really deal with the solution aspect?